Chapter 4, the musculoskeletal system, Part 2. We're going to be going over assessment terms, plan and treatment terms, and reviewing in depth a example of an electronic health record. So now that you understand, after watching Part 1, the musculoskeletal system function, certain bones, certain muscles, today we're going to focus on medical terms related to diagnostic and pathology, meaning what the person has, what specific disease is it, and how do we treat it, and the medical terms related to that. All right. So as you're reading through the book here, through the textbook or your online ebook, we've talked about osteopenia, osteomalacia. I wanted to bring your attention to these three suffixes here and kind of talk about those and the difference. Because osteopenia, osteomalacia, osteoporosis, bone weakening, but due to different diseases. So osteopenia, okay, penia means reduction in overall bone volume, which can happen as we get older, okay, usually related to age and diet. Osteomalacia is the softening of bones. Usually you will see that in either adults or young children, but it's mainly in young children due to a vitamin deficiency during bone growth. And then as people get older, osteoporosis. So poro here meaning small holes. Okay, this is loss of bone density due to over time, usually hormonal, and there again, diet, nutrition related, and age. So let's look at some of these terms related to diagnostic. So osteitis, inflammation of the bone, osteochondritis, inflammation of the bone and cartilage, osteomalacia, which we just talked about. This is bone softening. Okay, osteomyelitis. Notice the three word parts here. Osteo meaning bone, myelo meaning the bone marrow, which look alike, sound alike. That looks an awful lot like myo meaning muscle, right? So be careful there. Myelo means bone marrow. Myo means muscle. Osteopenia, bone deficiency. Osteoporosis could be the cause of osteopenia. And you see the difference here. The weakening of bone due to the small pores, less overall bone density. Spondylolisthesis here. Yep. Remember spondylo meaning vertebrae. Listhesis here means slipping. So this is the slipping of the disc or the dislocation here of the vertebrae. Can be very painful because remember you've got your spinal cord going through here as well, and nerves and peripheral nerves coming out and so forth. And then spondylosis, an abnormal condition of the vertebral column or of particular vertebrae. Arthritis, inflammation of the joints. Arthropathy, some sort of disease of the joint. Bursitis. Remember we talked about how this bursa sac is in certain joints, your elbows and your knees. So this is inflammation of that bursa fluid-filled sac here. Osteoarthritis, rheumatoid arthritis. This is where the immune system begins to degrade your joints over time. So it's inflammation of the joints because of the autoimmune system attacking it. All right, costochondritis. Costo meaning ribs, chondro meaning cartilage, itis meaning inflammation. So this is inflammation of the cartilage that attacks the ribs to the sternum. Muscular dystrophy, that term trophy again, the suffix trophy meaning poor development or bad nourishment. This is a umbrella term for many, many different types of genetic disorders that can cause muscular dystrophies. Myopathy, any disease of the muscle, tendinitis, okay, tenditis. The term oncology here, onco, meaning cancer. Okay, so the study of cancer. So, what are some of the cancers that affect the musculoskeletal system? So, osteochondroma, this term, the suffix oma here, can mean cancer or tumor or swelling. So, in these instances, we're using it as the meaning of a tumor. So, this is a cancerous tumor on the bone or cartilage. Chondroma, this is a tumor on actual cartilage. And then myoma, this is a tumor of the muscle. And then myosarcoma, this is a cancer of the muscle as well. It's just a different type of category. Muscle fiber here, sarco meaning flesh or body. So this is a type of cancer found in the actual muscle tissue. Right. So kind of short and sweet there. Understand your learning outcomes. Go through those. The next part here, 4.5, is treatments and therapies. So, what are some of the things that we can use? Some of the treatments, medications, therapies that we can use to treat some of these musculoskeletal disorders. And you see a common one here. This is a knee replacement. Okay. You see the femur here, you see the tibial head, and you see the hardware located in here that has been replaced through this x-ray. So let's look at some of the common things that are done to treat some of these musculoskeletal disorders and the words related to that. So as far as medicines go, we can relieve some of the pain by using an analgesic. I believe we've had this term before with the integumentary system, I believe. So an is the prefix that means without or none. Allege here meaning pain or algia. Okay, so analgesic. An anti-arthritic. This is a drug that specifically targets some of the crystals and cartilage health within an articulation joint, so within a joint, that can help relieve some of that pain. And then, of course, your myriad variety of anti-inflammatory medications. When it comes to treatments of the bone, you can remove a particular bone that's causing issues. And if it's a wrist bone, that's called a carpectomy, because remember your carpals are your wrists. If it's a rib, that would be a costectomy. If it's part of your skull, that's a craniectomy. Or if we want to just cut into the bone of the skull and look at what's in there or look at the bone, that would be a craniotomy. Okay, so make sure you study there the difference between craniectomy and craniotomy. When we're looking at joints specifically, arthroplasty is a very common one where they go in and they can reconstruct a particular joint in a variety of ways, whether it be with the bone, the tendon, the ligament, bursa sac. Okay. An arthrotomy, cutting into the joint. Chondrectomy, removing part of that cartilage. Hopefully by now with chapter 4, you can be looking through these and understanding how simple some of these terms are now. Okay, myectomy, yeah, got it, muscle removal. Okay, myoplasty, yep, got it. Plasty means reconstruction, a reconstruction of the muscle. So hopefully this is becoming a little bit easier for you. This term raphe, one of the double R suffixes, means to suture. Those can look alike, sound alike a lot with students, so make sure you're studying those, the difference between Rhea, Raj, Raphi, Rexis, those double R suffixes. Raj, Raphi, Rhea, Rexis. That means different things. In this instance, Raphi means to suture. Rexis would mean to rupture. Raj means excessive flow. Okay. I believe we've had all those before. And then, of course, learning exercises. And I wanted to end today by going over this example of electronic health record. This one's a fun one. It's on page 96. Okay, so kind of just to read through it real quick. Maureen Goldman presented, meaning she showed up to the office. This is the subjective part. To the orthopedic clinic, with a chronic history. Chronic meaning it's been going on for a long time, of arthralgia. She was previously diagnosed with osteoarthritis. She was initially treated with NSAIDs, which is a type of anti-inflammatory, and an orthotic, okay, or meaning a artificial brace or shoe, orthotic in her shoe or whatever it may have been. Not quite sure where's her problem. Oh, it's going to be in her knee. Okay. So probably a foot orthotic. But it is worsened over time. And she was eventually treated with an intra, okay, meaning within, articular, meaning joint, steroid injection. All right, but it's getting worse. So past medical history, she's had septic arthritis requiring hospitalization using IV antibiotics, intravenous. Okay, her physical exam here, her vitals, rate rhythm, no murmurs, cardiovascular system's good. Okay, but there's issues here with her musculoskeletal system. She has crepitation of the right knee, which means, ooh, when she bends her knee, she's hearing crackle and pop, snap, crackle, pop. Decreased range of motion, mild effusion, meaning she has fluid on her knee. Mild muscular atrophy, meaning poor development of her right quadricep muscle because she's not using that leg a lot because of the knee pain. So it's getting pretty severe to where her quadriceps are beginning to atrophy, meaning lessen, become less tone due to this knee pain. Okay. Looks like her labs are normal, joint aspiration normal, subchondral cyst, subchondral sclerosis. Okay, so yeah, she's got issues here. So what does the doctor say she has? What is the diagnosis here? Okay. They are recommending, okay, it includes osteoarthritis, rheumatoid arthritis, and bursitis, giving her history. She's not getting any better. She's had failed responses due to previous treatments. They are looking like risks and benefits of total knee replacement, arthroplasty, surgical repair. Okay, so they're wanting to schedule knee replacement here for her. Okay, here's the right one. This is the affected one, and you can kind of see a difference. I am not a radiologist by any means, but you can see here how there's much less space here between the joint here compared to this one. All right. And then, of course, you're learning exercises. So, medical record. And then I also wanted to make sure we go over, I believe at the end of this chapter, it is your page 98. Let me see. I wanted to go over some of those medical abbreviations. Here we go. Yeah, your page 98. And word roots, pretty sure you have those down. but it's right here. Some of these medical abbreviations I wanted to go over with you, especially some that we really didn't talk about in detail yet. Wanted to begin with these four right here, the different ligaments that attach the knee together. So your ACL, MCL, LCL, and PCL. Wanted to make sure you kind of saw what those were or are and kind of put them in context here. So your textbook did not really give you a good picture of what these ligaments look like. So I wanted to kind of give that to you here and briefly talk about some of that. So let's see if I can make this a little bigger here. Here we go. So, and you see the abbreviations are here. So let's start from the front. Your ACL, anterior meaning front. Okay, cruciate ligament. Ligaments link bone to bone. So it's in front. It's on the posterior side. How do we know that this is a posterior ligament? Well, because we see the patella here, and the patella is an anterior bone. You also see the bridge here of the tibia and the fibula here on the lateral side. So we know that this is lateral, this is medial. But the anterior cruciate ligament, meaning it means it is in front of the posterior ligament. So you kind of see here how this one's in front of this one. So anterior ligament, posterior ligament. And then we have our lateral medial. There again, we know this is a lateral collateral ligament. We know this is lateral. Notice how it is connecting the femur here to the fibula. We know this is lateral because the fibula is always lat. Fibula is always lateral in anatomic position. So we know that this is the lateral ligament. We know that this is the medial ligament. So this is the inside of the knee. This is the outside of the knee. Patella here. So I wanted to kind of show you those so you kind of know where these abbreviations are coming from in this quick reference. The next one here I wanted to bring your attention to was right here. We did talk about the cervical vertebrae and the thoracic vertebrae and the vertebral column as a whole back in part one. But now you see these abbreviations C1 through C7, T1 through T12. When we didn't really talk about that in a whole lot of detail. So I wanted to kind of draw your attention here to one of the slides from the anatomy and physiology class that I teach to show you kind of the difference here. So cervical vertebrae, thoracic vertebrae, lumbar vertebrae, and sacral, also known as pelvic vertebrae. So kind of refresh your memory of where those are. And then when we look at the individual numbers, you see if I can, I don't know that I can zoom in anymore here, but you see the cervical vertebrae are numbered. Each individual vertebrae is numbered. So this is where the C1, C7, T13, all of these letters and numbers come from. So cervical vertebrae, C means cervical. Then you have C1, C2, 3, 4, 5, 6, 7. Okay. So depending on which vertebrae is injured or fractured or slipped or whatever, it gets very specific. Same thing here with thoracic vertebrae. Okay, T1, 2, 3, 4, so on and so forth. Lumbar vertebrae, lumbar meaning lower back, lumbar 1, 2, 3, 4, 5. And then your sacrum, I know it's hard to see here, but your sacral vertebrae are fused together, but actually they are, let me see, yeah, but actually they are 5 individual vertebrae that have been fused together. And you can clearly see those here, 1, 2, 3, 4, and 5 fused together. Okay. And even your coccyx here, okay, is one individual bone, but it's 3 individual, very tiny vertebrae fused together. So little bit of anatomy lesson there, but I wanted to kind of bring that to your attention so that you had that when you're kind of scratching your head when you're studying these abbreviations. You're like, well, wait a minute, she didn't really go over those. So wanted to make sure we did that before we left today. Please let me know if you have any questions or concerns. Thank you.